viewers at home and around the world, we're happy to be back today on WAP TV. The name of the program is still Health Matta on WAP TV. And today we have a special guest in our midst, okay? But before I introduce him, I'd like to start with Slimmy T. Good morning, Slimmy T.
Good morning, sir.
So good to have you today.
Always a pleasure. Good morning. Good
Yesterday
morning, sir.
was International Women's Day.
Yes. Thank you guys for celebrating us. We're all over the place.
You guys are celebrated. We appreciate the enormous work you're doing in the family as well as our nation.
Thank you so much, sir.
Okay, so we have in our midst today a special guest. His name is Dr. Theophilus Umeizudike. He is a consultant nephrologist working with LASUTH, Lagos State University Teaching Hospital. Okay, and beside him is our chief. We all know him. Our Mosai chief.
Indoor doctor.
Yes, so.
Indoor doctor.
Okay, yeah, thank you.
He's our outdoor doctor.
Good morning.
Thank you very much.
Morning,
Okay, so the topic today
thank you.
is still kidney health. Don't forget, every second Thursday of March, the world celebrates World Kidney Day. And the theme of this year's World Kidney Day is kidney health for everyone, everywhere. So we're going to talk about kidney health for everyone, everywhere. Essentially, we're talking about universal coverage for kidney-related problems all over the world. Okay? As a word of introduction, over 850 million people are estimated to have kidney diseases at the moment from various causes. That is to say that 1 in every 10 people have CKD, which of course is chronic kidney disease, a non-communicable disease, okay, that affects. Don't forget also that last week we did the introduction. We talked about the anatomy of the kidney, the functions of the kidney, as well as the challenges that can occur with acute kidney injury. So with us today to do justice to the topic is a consultant nephrologist. So at this juncture, I want to welcome once again our chief. Chief, you're welcome, sir.
Thank you, sir.
Yeah, thank you. So you have the floor, sir.
All right, so I want to thank WAP TV and my colleague, Dr. Bath, for inviting me to be here, and I really appreciate this.
Thank you very much, sir.
And I hope that as we enlighten people and create awareness about kidney disease, that the scourge of an epidemic of kidney disease that is quite alarming all over the world will not continue to increase, but we'll see some measures taken by individuals, by governments, by corporate bodies to help to stem this tide, because kidney disease anywhere is expensive to maintain in terms of treating those who have come down with chronic disease, chronic kidney disease. And what we need to recognize is that oftentimes, like we talk about hypertension being a silent killer, chronic kidney disease or kidney disease that affects the kidneys that becomes irreparable and does not reverse, tends to present in a way that nobody knows the symptoms. I mean, in the early stages, it's completely asymptomatic. The person doesn't have symptoms. So like you need to check your blood pressure to know whether it's normal or elevated or low. That's the way it is with kidney disease. You need to check certain things, certain urine and blood tests to be able to know whether your kidneys are functioning optimally. And oftentimes, it's not something that you detect by doing malaria or typhoid tests, which is what many people tend to do often when they're ill. They just do malaria parasites, they do typhoid tests. Urine test is even cheaper than these 2 tests because the urine test is something that you don't need to be pricked. Your urine can be passed into a little container and the sticks put into it to find out if there's protein or blood or white cells or any other abnormality in the urine. So that can be a starting point that if we decide that we want to do a routine check or an annual check, or just you're not feeling well, make sure that aside from doing your malaria or typhoid test, do a urine test. That is a very significant way of picking up kidney problem in its early stage. The other thing that we need to know is that kidney disease often comes in a way that it affects, like was stated earlier, about 1 in 10 people in a population are affected. Now, what are the things that can cause this chronic kidney disease? So in our environment, oftentimes high blood pressure that is not treated and remains the #1 cause of kidney disease in our environment. In other parts of the world, it's diabetes mellitus. But I need to come back to hypertension because hypertension affects quite a significant proportion of Nigerians. That recent studies that have been done have come up with figures of between 4 to 5 Nigerians out of 10 Nigerians affected by high blood pressure. So if you look at that statistics, that's up to 40 to 50% of Nigerians may be affected by high blood pressure. That's a significant proportion if you consider the population of 180 million. Yes, it will not be found mostly, it will be found mostly in young people and people in their middle age and elderly. And of course, hypertension is something that tends to begin to occur as people get older. But we're beginning to find hypertension in very young people who are in their productive age, and they're the people that should be providing the workforce of the country. And if these people become incapacitated because the hypertension they have was not detected and treated, it becomes something that's also of concern. So that's why we need to raise awareness that people need to check their blood pressure. Not just their blood pressure, you need to know whether it's controlled, because sometimes some people who have kidney issues, you see this young person, and the person is probably an undergraduate or a graduate, or even in the working class, and you ask them, okay, you went into a higher institution, you were screened at the point when you were admitted into that school. Was your blood pressure checked? If it was checked and detected to be high, what was done? Did the person that saw you then think that, oh, it may be that the person was just anxious? That point of screening, it's something that should be taken seriously. So same for pre-employment testing. When people are about to be employed into a job and they checked and they're found to have high blood pressure, sometimes it's discounted as, oh, you may be thinking about something. No, it should not be discounted as. If it remains high above 140/90 persistently, that needs to be treated. And in treating it, the person needs to be not just on medications, but also some lifestyles that will help to mitigate and reduce that blood pressure, because in as much as we emphasize the need for people to be on medications for high blood pressure, there are also non-drug formulae or non-drug treatments that should be instituted, like lifestyle, and that goes a long way in helping to control high blood pressure. So coming back to that, we need to know our numbers. We need to know what your blood pressure is. You need to know that it's below 140/90. And if it's above that, you need to be on treatment. And along with the treatment, you need to remember that you need to do exercise after you've been properly evaluated to be sure you don't have any heart condition that could predispose you to sudden cardiac arrest, because if you don't properly evaluate yourself and you do exercise, you could just drop. And that has been reported. You've seen footballers who just drop while they are on the playing field. It's because they were not properly evaluated and measures were not taken to be sure that these conditions can be risk factors for sudden cardiac death. So aside from doing exercise, you need to know that you need to cut back on your salt consumption. So salt is something that is universally known, especially in blacks, to be something that puts black people at risk of developing hypertension. So you need to cut back on your salt intake, and also foods or things that contain lots of salt. And oftentimes I advise people that when they are diagnosed with hypertension, they should do their best to eat homemade food, because you can't control the salt that you eat outside from outside sources. You can't tell the food maker to restrict the salt they take. So you need to look at how you can do more of homemade. Oh yes, occasionally you eat out, but try your best to eat homemade food where you can actually control the amount of salt that is used to prepare that meal. And then, of course, you need to consume lots of vegetables and fruits, which will go a long way also in providing things that will mitigate and reduce the blood pressure. So, in studies that have been done,
What about smoking and alcohol, sir?
yes, so
As well
those
as,
are lifestyles
drug
that
abuse?
yes, those are lifestyles that should be stopped. If a smoker is diagnosed with hypertension, he needs to stop smoking, because that smoking puts him at risk of persistently elevated blood pressure. It also puts him at risk of kidney issues or kidney problems, and of course other health-related issues like cancer that smoking brings along with it. Alcohol, yes, has a negative effect on the blood pressure because it tends to worsen blood pressure. So as it worsens blood pressure, that also puts its own negative effect on the kidneys. So, of course, taking herbal remedies, which are quite numerous in our environment. The thing is that people will say, well, our fathers or our forefathers used these things, and it didn't have effect on them. Now, you need to understand that many of what is available now will not be as good as what they had in their own days. And also the fact that in those days, we didn't have facilities that we have now to be able to detect the effect that these things can have on the body. So some of those people may have gotten away with what they used because of the fact that somehow maybe their genetic makeup for some of them was able to contain and not allow them to come down with the negative health effects. Of course, herbal things have their own good side. But when those things are not well constituted and regulated, it becomes an issue that they can bring long-term health challenges that will impact negatively on people. So we need to look at all those and put them. Of course, using analgesics also, abusing analgesics goes a long way in making people prone to kidney disease that can be reversible. If it's something that is used once in a while, yes, it's allowed, but if it's something that someone uses every day because he's tired, he's having body pains, he needs to be careful, and he needs to know that there can be health consequences if it's used on a prolonged usage. Of course, if people are also overweight, or obesity, that's another risk factor for kidney issues that can have negative effect on the kidneys. Then looking at the other aspects, undernourishment, when people are not well nourished, especially for mothers. Yesterday was International Women's Day, and that's quite remarkable that women are celebrated. But we need to know that women need to be well fed so that they don't have premature babies. When a baby is born prematurely, that baby is already at risk of kidney challenge and many other health issues. So that when a woman is pregnant, she needs to be well nourished. She needs to be maintain a very healthy body so that she can have a baby at the right time and not prematurely. Because prematurity is a risk factor for kidney disease in later life for such babies that are born prematurely. They tend to have smaller kidneys, and with smaller kidneys comes the effect that they may develop hypertension later on in life. They may develop kidney disease. So women need to be well fed and have good nourishment when they are pregnant. And yeah, so
thank you very much.
It goes on and on.
Sorry,
Thank
sir.
you very much, sir.
Maybe I should take Dr. I'll take Dr. Bat first, then I would also take you. So it's a 1-1 for you. For Dr. Bat, you as a GP, I want to ask, from what Dr. Theophilus said, how often do you think we can run a urine test? Like, how many times do you feel we should do it in a year? Then I think the financial cost too, still you can do that because as a GP is what you do daily. So what do you think? What's the financial cost or implication like that for you, sir? Then for Dr. Theophilus, you said that the kidney problem, that the hypertension thing, it's not as common as we have these days. Like youths now have it, unlike the olden days where it's something for the aged or the older people. but now youths have it. So the question I want to ask here is, what is the reason for hypertension in youth these days? Could it be the social stress or lifestyle? Which do you think poses more danger? Is it our lifestyle, or you feel is the social stress? We cannot shy away from the fact that we go through a lot of stress these days, which were not there in those days.
Yeah.
So it's for you.
Okay, thank you very much for those questions, wonderful questions. How often can one do urinalysis in a hospital? I do know that in this environment, most of the time when patients come into the clinician's office, some of the things they will personally request for. Doctor, I want to do tests for typhoid and malaria. And usually when they said, I want to do tests for typhoid and malaria, what they have in mind is MP as well as wider. But unknown to them that even tests for typhoid is beyond just doing wider. As a matter of fact, the wider happens to be the least in terms of, if you're talking about how effective a test for typhoid can be, the wider is actually the least. There are other things that you can do that can actually identify if such a person have typhoid, ranging from culture, in which case, depending on the time you're meeting the patient, you need to do blood culture if you're meeting the person within 4 weeks of presenting with symptoms. You need to do a stool culture. You need to do also a urine culture. And you can also do a bone marrow culture in places where the facilities are available. But beyond all this, I think, like he has rightly advised, if you're going to hospital to request for tests, also include urinalysis. Today, you know that with urinalysis, you can actually detect if you're having kidney disease or not. So let us also form the habit. If we know MP and wider, let us also know urinalysis as well. How often? Yes. How often can we do it? As much as you get to the hospital. But everybody should have it done at least quarterly. We have 12 calendar months in a year.
3 times.
Yes, every three months, if you're able to do it. It doesn't cost so much. In terms of cost, I know most hospitals, the cost will hover between 200 to 1,000 naira.
Wow.
So it's something everybody can afford.
Wow.
Okay?
Wow.
Thank you very much, sir.
Okay, to you, Dr. Theophilus, the question on the hypertension now being predominant in youths, unlike we have before, what do you adduce to this?
Well, I'm not sure I made that statement.
Okay.
But what I try to highlight is the fact that we can detect this in young people. It's not that it's commoner in them. Okay. No, it's not. But some people do come down with hypertension in their teenage age, or even as a child. So it's not that it's commoner in them. No, it's not. It's still commoner in middle age and elderly. And it's something that comes on with age. As people get older, they tend to develop hypertension. So women, when they're in their childbearing age, may be at risk of hypertension because of pregnancy and some other things happening around that time. But after menopause, they tend to be quite at higher risk of developing hypertension than when they were still in their childbearing age. So it's like a mixed bag for women. For men, generally, from about the age of 40, 45, they tend to develop hypertension. So it tends to occur earlier in our environment compared to developed world. Maybe the stressor is a factor.
Or salt consumption.
Or salt consumption. But recently, in the last 10 years or so, a genetic component has been identified that has put blacks at a far higher risk of kidney disease compared to their white counterparts in America. And if those people migrated from here several years ago, it simply means that whatever is affecting them and making them more prone to kidney problem is likely to be also be what's making us prone to kidney problem.
Thank you very much. Thank you very much, sir.
Now,
yes.
Yes,
Abubakar, good morning.
Yeah, good morning, doctor. And good morning, guys in the studio.
Good morning.
Good morning.
Yeah, I'm calling from Adamawa.
Yeah, good to have you.
I've been going to the hospital quite recently with kidney. They have been saying like I've been diagnosed with kidney pyelonephritis or something. They have put me on drugs for so long, but the problem has been persisting. It goes from the left kidney now. It's now coming back to the right kidney. The pain is consistent. I'm having pains while urinating, and and everything. And I don't know. I'm tired of the drugs. I've taken it for a long time, and I don't know.
What's the name of the drug you've been on, sir?
It's been like all these 500 milligram Cipro tabs with they have been giving me different kind of drugs, and I can't really. I've forgotten the names. The last time I stopped the drug was like last week.
Okay, I'm sure the doctor had you. So
yeah, I think the doctor. If the doctor have any advice for me or something.
Okay, so well, it's quite a challenging situation sometimes when people have a recurrent urinary tract infection. In men who are less than 50 years, a number of things could be the reason. It could be that the person has some stone in their urinary tract, which forms a nidus for infection. It could also be that the person has some abnormality that is just manifesting late in life or later in life. If the person is over 50 years, most likely it's going to be a prostate issue that is become enlarged and it's obstructing the urinary tract. So we need to, he needs to see his kidney specialist. They may need to run a more extensive investigation to be able to highlight what the challenge is.
I think he mentioned pyelonephritis.
Yes. It doesn't occur usually in men, except if they have a prostate issue or stone. So we need to know what's predisposing him to having pyelonephritis, something that is commoner in women, maybe in pregnancy, or those who have some other obstruction of the urinary tract, because oftentimes urinary tract infection comes on where there is some obstruction. Of course, it could also be something that starts in the bladder region. So if there is some bladder stone or some issues with the bladder, it could also predispose to an infection that will just go up from the bladder to affect the kidneys. So he needs to be well investigated to know why he's having that persistent infection. It's usually something that must be there that is creating what is called a nidus for germs to keep proliferating and be difficult to clear, but oftentimes it's something that is treatable.
Thank you very much, sir. Abubakar, if you haven't seen one, you've been advised to see a nephrologist, okay, so that you can be properly evaluated and then the right treatment commenced. Sir, at the beginning, you talked about that chronic kidney disease can sometimes be asymptomatic, can sometimes show no symptoms. But what are the early symptoms? In some situations where we could have symptoms, what are the early symptoms? What are the late symptoms? I think we need to know, sir.
Right, so usually we classify chronic kidney disease into 5 stages. Stage 1.
Sorry, I will have to stop you. I think we have Mariah from Kano. Good morning, Mariah.
We lost her.
Sorry.
So chronic kidney disease is classified into 5 stages: stage 1, stage 2, stage 3, stage 4, and stage 5. So oftentimes stages 1 and 2, there are no symptoms, although some people could have symptoms. So if we start with the urine could bring foam, lots of foam when somebody passes urine, lots of foam in it, or blood in urine, or waking up at night to urinate more than 2 times. It's not just kidneys that can cause that, but it could be from kidney issues. Also, when the legs start swelling, maybe in the morning, the person wakes up and the legs are swollen, or the leg swells anytime. Also, the fact that when somebody takes a step or walks some few meters, feels breathless, feels tired easily if you walk some distance. It could be a manifestation that there is some kidney.
Let me pause you a little. Obina from Rivers. Obina, good morning. How is Rivers today?
Fine, sir.
Thank you. Please go ahead with your contribution or question if there be any.
All right. I want to ask a question based on my health. I'm having this pain in my waist.
Okay.
So I've been taking a lot of drugs for a long time now, and the thing seems like is not going away.
Okay. What's the name of drugs that you've been on? The painkillers.
Like a cataflam. Yes, painkiller.
Okay.
Cataflam and other many drugs. I've been diagnosed and there seems like nothing is wrong with my bone.
Okay, thank you very much. I'm sure doctor will answer the question. He's been having waist pains and he's been on painkillers for a long time.
Right, so for
Inside my bum.
Okay, okay. Thank you very much. We had you, sir.
All right.
So I don't know how old he is, but we need to consider
Age factor.
Yeah, age plays a vital role. When somebody in their late 50s, 60s, 70s, they're having low back pain, one of the things we'll need to consider is a condition called multiple myeloma. Apart from a commoner thing like aging process of the backbone that can give chronic back pain, but we need to consider a condition called multiple myeloma because that is like a kind of cancer of the bone, of the bone marrow, that tends to affect the bone and it can cause kidney problem. So he needs to see a specialist to be able to evaluate him properly. Is he just having low back pain because of age, or could there be a multiple myeloma or some other things that it could be a spread, it could have a prostate issue that is spread into that back. So it needs to be well evaluated to be able to know why he's having a chronic back pain. Yeah.
Thank you very much, sir. Obina, you've had him. You need to see an orthopedic surgeon. You need proper evaluation. Okay, so that said, what are the other risk factors? You've mentioned diabetes, you've mentioned hypertension. What are the other risk factors or some other causes of chronic kidney disease? And this chronic kidney disease, if someone presents early, is it curable or not? We need to know, sir. And then what is the major difference between acute kidney injury and chronic kidney disease, CKD?
Maybe, sir, sorry.
Putting so many questions at the
So
same
maybe
just to back him up on the question, my question is in the same line with his.
We'll be reminding you.
Must all chronic diseases result into kidney transplant, or early detections now can actually, what do you feel about? Because most kidney diseases I've seen, or most kidney problems.
And outside that, we had at least a celebrity that actually had a transplant, and at the end of the day, he ended up dying.
Okay, so many questions.
So you can start with them.
I know you can multitask.
Risk factors. Let's start with
Let me
risk
start with the
factors.
risk factors.
Okay.
So we've mentioned hypertension, we've mentioned diabetes,
Yes.
we've mentioned obesity, we've mentioned smoking, we've mentioned alcohol,
Too much of salt.
the excessive salt. Then we can come to conditions like sickle cell. Sickle cell is prevalent in our environment. So up to about 25% of people have AS and about 2 to 5% have SS.
Okay.
So either of them, whether AS or SS, they are at risk of developing kidney problems. So those people who have these conditions need to have their kidney function checked from time to time.
Sorry,
so
sir. We have Akoshile.
From Kwara.
Akoshile, good morning.
Good morning, sir.
How are you doing?
I'm fine.
Yeah, the doctor
I
is here.
want to ask a question regarding the program that is on.
Okay.
I have been diagnosed to have kidney problem of stage 3. My problem is that I initially started seeing swollen ankle. So I went to my hospital and I was given LASUTH. So I've been taking LASUTH for some time now, and the swelling has been coming down. But of recent, I went on internet and I learned that taking this hypertensive drug, lisinopril, can also lead to chronic kidney disease. So I want the doctor to kindly assist to shed more light on this.
Akoshile, how old are you, sir?
I am 52 years.
52.
Thank you very much, sir.
Okay, so taking antihypertensive drugs to treat hypertension, every drug has side effects. And these drugs, it's been documented that some of them can lead to progression of somebody who has advanced kidney disease, that is stage 4, stage 5. And some people have reported that it can lead to worsening of their kidney function. But oftentimes, when it worsens kidney function and the person continues using the drug, it reverses. So it's something that is known that, yes, it could worsen it temporarily, but as the person continues using the drug, the body adjusts and it reverses because of some things that happen in the two kidneys when the drugs are commenced. So in looking at the stages of kidney disease, I said stages 1 and 2 usually don't have symptoms, but from about stage 3 and 4 and 5 are the symptoms I described. Waking up in the night, urine becomes very foamy, legs swelling,
Facial swelling.
The face swells, walk some distance and get tired. When it gets to the late stages of stage 5, that's when the person can be vomiting. They have very poor appetite, their taste changes. Some of them can present in coma, some can have seizures, some can have what is called chest pain or cough. So those myriad of symptoms, and then when they present in the hospital, then that's when they are needing dialysis. But if the person had taken time to be screened earlier and had annual checks or half or quarterly checks, it would have averted this, because we know that when people are screened, like we'll be doing a screening on March 14 on Walking Day in different parts of Lagos. When people are screened and they are found to have this condition, we can actually give drugs, change lifestyles that can mitigate and prevent them from progressing from early stage of 1, 2 to 3, 4, 5. And in many countries of the world where government
let
funds...
me pause you once more. Uche from Enugu. Uche, good morning.
Good morning.
Yeah. Please go ahead.
Okay. I want to ask a question based on the question I asked last week.
Okay.
Good morning, sir.
Yeah, good morning.
Yeah, last week I asked a question. I did not answer my question. I asked about... Yes, I want to ask if taking decaffeinated coffee can cause kidney problems.
Thank you very much. Thank you very much. I was actually going to ask your question before he came in.
As a matter
but
of fact,
all the same,
Dr.
apologies. Apologies for that. So, sir, our question is taking decaffeinated coffee. Okay? Can it pose a challenge? Can it cause kidney problem?
Yeah, so those are, say, gray areas in medicine.
What do you mean gray, sir?
Gray area means it's neither here or there.
Okay.
Say undergoing research.
There are researches that are pointing towards saying that coffee is healthy, whether decaffeinated or not.
Okay.
There are other researches that came out several years ago saying that once somebody is diagnosed with hypertension, you don't go near coffee because coffee has caffeine, which is a stimulant.
Okay.
And stimulants will make the heart more excitable. So somebody's heart will begin to beat faster, or it may put the person at risk of developing what's called arrhythmia. So the heart just begins to beat in a very abnormal way. And if somebody has hypertension already, apart from hypertension affecting the two kidneys, it can also affect the heart. It can cause a stroke, can affect the eyes, it can affect the blood vessels and cause peripheral vascular disease. So those are things that can come as a result of having hypertension. So you don't want anything that will worsen any of the organs that hypertension can affect when somebody already has hypertension. That was why early research said don't do coffee once you're diagnosed with hypertension. But more recent research coming to say, oh, you can actually. But it's neither here or there. I know that with time, when we do systematic reviews of all the studies that have come out from all these, we may be able to be more precise to say, okay, don't take decaffeinated coffee or take. So for now, it's still a gray area. Yeah, so...
Okay, so major differences between acute kidney failure or acute kidney injury and CKD, which is treatable and which is not treatable.
Right, so acute kidney injury had previously been thought to be something that is completely reversible. That means that if somebody comes down with acute kidney injury, which can be from...
We have Engineer Agode from Bauchi.
you.
Engineer Agode, good morning, sir.
Good morning. How are you?
Fine, thank you. You have the floor, sir.
Yeah, okay. Yeah, good morning. How are you doing?
We are good.
We are
We are
fine,
good.
sir.
We are
Please
great.
turn down the volume on your TV set.
God bless you.
God bless you too.
I have a question. It has to do with. Okay, I will. I have the same complaint that I complained of not too long ago. I'd rather to waist pain. And each time I take little alcohol, the pain becomes more severe. So I don't know what do you advise to go for.
Did you get him, sir?
Can you come
you
again,
have to
please?
take that
Can you take the
be
question
audible. Your volume is still on the high side.
Hello?
We didn't hear you. Can you come again? Can you just repeat what you said?
Yeah, I said I have waist pain.
Waist pain.
Okay.
And the pain has been long for quite some almost.
Okay.
Okay, it has to do with waist pain. Waist pain.
Okay.
Yeah, and this thing has been long now for over almost 25 years now. I've been battling with this waist pain. And as of now, I feel I should be 60 now. Okay. So when you move 25 from 60, that means I should be 35 then. Am I correct?
Okay. How old are you, sir?
I'm now 60.
68. Okay, I'm sure doctor will have some answers.
But you said something concerning
alcohol.
alcohol.
The question is this. If I take alcohol, no matter how little it is, it pain becomes more severe.
Okay, so aggravated by
alcohol.
Intake of alcohol.
Okay.
Thank you very much, sir.
Thank you, sir.
Thank you.
It's just similar to the question that came in earlier.
Yes, so
Still on back pain.
I mean, he doesn't need a prophet to tell him that he should stop alcohol.
I think we're on the same page.
Just simple.
I think we are on the
He
same
doesn't
page.
need a prophet to tell him that he should stop alcohol ingestion. So, going back to the question Dr. Bath asked earlier on, acute kidney injury and chronic kidney disease. I said acute kidney injury was previously thought to be a disease that people recover completely from after they've been treated, either with dialysis or without dialysis. But recent research is coming up to say that, look, this acute kidney injury places people at risk of developing chronic kidney disease. So acute kidney injury usually stems from the fact that somebody who previously doesn't have hypertension, doesn't have diabetes, suddenly comes down with an acute illness, which could be within a few days or a few hours, and the person suddenly is unable to urinate, starts vomiting, and needs to be admitted, and sometimes they will need dialysis. But also we know that people who are admitted into the hospital, for one reason or the other, they are at risk. Up to about 10% of in-hospital patients are at risk of developing this acute kidney injury, maybe from the drugs they are taking or from the fact that some other organs that they had issues with when they came into the hospital become so impaired that blood flow to the kidneys is affected. So acute kidney injury potentially is a condition that is reversible in many cases, but it could be a risk for people to develop chronic kidney disease. So once somebody has recovered from acute kidney injury, we still need to follow up the person in clinic to be sure that they don't develop chronic kidney disease. And in any event, some people who are maybe stage 3 chronic kidney disease, they could have an acute illness and they suddenly come down with needing dialysis. And at that point in time, when we do dialysis for them over some weeks or months, they recover fully and they don't need dialysis again for years. But they still may be at risk of needing dialysis later in life. So the question you asked earlier on about somebody having a transplant, all over the world, people have this procedure done. It's done in Nigeria in several centers now. And that's a good thing that has helped to reduce tourism or people taking scarce resources to other countries. But the thing there is that anywhere in the world that transplant is done, the person, the success rates for 1 year, after 1 year, over 98% of those people are still alive. By 5 years, it goes down to about 80%. By 10 years, it goes down to about 60%. So it's a far better lifestyle than being on dialysis, and it's also cheaper. And that's what I've tried to encourage my patients who are on dialysis, that look, if they can get a transplant, they stand to do better. They don't need to come into hospital so frequently to do dialysis or
saves
be on
costs.
several.
Costs too.
It saves costs. Yes, they need to be on medications after the transplant as immunosuppressive drugs for a lifetime, just like anybody who is on a chronic on treatment for a chronic ailment. So, and many things can happen when somebody has had a transplant. They may not be able to afford the medications, so the graft will fail, or they could have rejections, or they could have a recurrence of what caused the primary kidneys to fail in the first place. So these things need to be looked in perspective. It's not everybody that gets a transplant that the graft eventually fails. No. Yes. Several people I know in Nigeria are living with one transplant for over 10 years. So that's something that the people need to disabuse their minds from, that it's not something that is usually successful. It's successful in many cases, but in the biggest centers, privileged to be in Cambridge, UK, and the consultant told me that, look, of their patients, 50% are on dialysis and 50% have had transplant. Now, even those who have had a transplant, the thing that is making people come back to dialysis is even failed transplants. Even in centers where government is supporting people with dialysis, with transplants,
and with statistic implements to do so.
Yes, so they're able to get the statistics that, look, after a transplant, it doesn't mean that the kidney issue has been cured. It just means that it's been treated, and the person can be on drugs to medicate the graft, to make sure the graft works optimally, and that in working optimally, they don't need to go back to dialysis. But in the event that the graft fails or something happens, they can go back to dialysis.
Wow, why I still have more questions?
I think we'll have to crave his indulgence, beg him. Of course,
because I have just 6 more questions.
Yes, because we know 14th of March is on Thursday. So, Thursday. Chief, can we have you around one more time on Saturday? That will be after the 14th of March. Is it possible? I know you're a very busy person. Sorry, I'm putting you on the line. I'm putting you on the spot.
We'll talk about it afterwards.
Okay, thank you very much. Okay, so viewers at home and around the world, we must thank you very much for tuning in today. We're going to have you again next week. And from me, it's bye-bye.
From us, yes, Doctor.
Thank you
for having me.
Thank you very much.
Thank you so much for coming, sir.